So I think it's worth starting our webinar today. So good afternoon, everyone. Thank you for joining. Today's webinar is Net Zero Tomorrow, Innovating for a More Sustainable NHS. So before we begin, I'd like to note that this webinar is being recorded. So it's going to be made available after today's session on YouTube for anyone who wishes to review or to share it with colleagues who might be interested in the content as well. So if you have any questions during the session today, please pop them into the chat and we'll be pulling them together and addressing those in the Q&A session. So I'm Fiona Schaefer, and the aim of today is to provide some examples just to inspire you and encourage you to think about sustainability in all aspects of what you're doing, hopefully coming up with new ideas and solutions to address some of the challenges we've got, also to encourage you to look to projects and other activities like Design Hopes to actually bring in new ideas or learn about best practice. So today's webinar is going to start with a brief introduction about Inner Scot Health and NHS Scotland with their net zero target of 2040 and the challenges we're facing before moving on to Design Hopes programme. And delighted that we've got two key speakers from the project. So Design Hopes is a multidisciplinary research project which aims to exploit the potential of design-led thinking and making to innovate and tackle some of these really challenging problems we have in this area. And it's funded by the Arts and Humanities Research Council. So, projects range from quite researchy to further down the line, which we're going to hear about. And it's a collaboration between 5 Scottish universities and NHS Scotland, third sector and design organisations. So they've done some really interesting things. So today's speakers are Professor Paul Rogers, who's co-director of Design Hopes and theme lead, Professor of Design at DMEN, Design Manufacture Engineering Management at the University of Strathclyde, going to talk to us about reusable theatre cap project, amongst others. And he's going to be followed by Fraser Bruce, who's product design engineer at Duncan & Jordanson, I think, at Dundee, who will talk about Green Ward Toolkit, which is about equipping staff with relevant tools, and we'll hear about their project. And so I'm really keen for you to put together some questions that you have, and we'll discuss those following their presentations towards the end. So a few words about us. We are have been supported by the Chief Scientist Office to provide technology transfer services to NHS Scotland. We've been doing this for over 20 years now, with a focus on, inspiring staff, empowering them, encouraging them to develop new innovative solutions, leading through to launching products and services. And our focus is very much on developing or enabling or creating a financial return as well as patient benefit. So we've got a wealth of expertise from that initial recognising the idea, protecting the intellectual property, managing that, product development. We've got regulatory expertise through to support that commercialisation journey, and after that as well. And that's resulted in, at the moment, we have around 18 income generating licenses, and royalties from those are the order of about 250,000 since 2021. And that's royalties that are returned to NHS health boards. And we do have some spin-out companies that we've spun out and continue to support, and the estimated potential of the spin-out portfolio value is around 30 million for these. So onto today's topic about sustainability. I'm not going to read the whole of this out, but it's worth just thinking about. This is a global challenge that we have, and to quote WHO, it's a global challenge, and it's very much about we need to be developing environmentally sustainable healthcare systems because they need to be improving, maintaining, and restoring health while minimizing negative impacts that they might have. And so I think there's a lot can be learned. There's a lot of global resources that we sometimes look very local, but there's a lot to be learned internationally, and like how there's a lot of resources and how that sharing of best practice. NHS carbon footprint is significant. I did read recently that the NHS's carbon footprint is about 6% of the nation's carbon dioxide emissions. And then if you're looking at in Scotland, recognising that that's significant and we need to be able to address that. The Scottish Government has an ambitious target to become net zero, as NHS Scotland to become a net zero organisation by 2040, but also for its supply chain to also achieve net zero emissions by 2045. So it's going, very much far beyond the just reducing energy use or maybe being, better at recycling or using a bit less plastic. It's much more strategic, and it needs to be, there are a number of different factors that need to be considered. The strategy looks at the sustainability in terms of buildings, land, travel, care, and communities. So it's having to look much more holistically, and that means that's the current strategy. It's there's been a lot of work that's been done for a number of years. A number of the health boards have specific frameworks and sustainability action plans, and how procurement operates is going to be changing. And I think that's where I wanted to kind of highlight a couple of examples from the UK Design for Life roadmap UK government put together with involvement of the four nations, and just to sort of think about how you're designing new products and services. And people, you might have a great idea for a new medical device, but actually at that early stage, or actually long before you actually get to manufacture it, how can you actually design in other, how will it be repaired? Could you maybe rent it? Is it, actually how are you going to maintain those devices so they've got a longer life? There's a whole range of different aspects. So Wendy Rayner is the head of circular economy for health, and she was highlighting this at the Medical Device Manufacturing Centres conference yesterday. I think it's really important to think about that. NHS England, it's estimated that approximately 70% of its total carbon footprint is related to goods and services it purchases. So that's quite a lot more than the energy, turning off the lights, etc. And one specific example they gave is of surgical products. 23% of surgical products make up 80% of the carbon footprint of the top 5 most common operations. So thinking about things in, we have so many single-use products. We've dealt with it for obvious reasons, infection control, regulation to make sure products are safe and do what we need them to do. But there's an great opportunity now for redesigning, reconsidering using different materials, etc. So I'd really recommend it. It's quite dry report with not very many pictures, but it's worth having a look to think about. Are the things that you're doing, could you do them differently? And I think we're going to obviously hear a bit more from our speakers today about some of the things that they're doing and how you can actually learn from that. An example of one of our projects where sustainability is one element of it has actually been reusing old NHS fleeces, which actually is quite high quality fleece, as part of a new scrubs design to keep baby warm after an elective section, so the dads or birthing partners can actually cuddle the newborn baby, whilst mums or the birthing parent is actually recovering from the section and the operation, obviously, where it's quite difficult to do skin to skin, which is found to be very effective at improving outcomes for babies. So this is Stacey and Marianne, who are the innovators behind this new scrubs design with the new box to try and collect more scrubs, more old fleeces to be used in the next, with manufacturing partner that my colleague Paula Sweeten is managing, that, you know, engaging with a Scottish manufacturer who's keen to have that sustainability factor to actually, it's better quality fleece that they can use in these new scrubs, sort of cuddle scrubs design. So without further ado, I'd like to introduce Paul Rogers, Professor Paul Rogers, who's going to talk more about the Design Hopes project and one or maybe more of the projects that he's been involved with. So you're free to share now, Paul. Thanks.
Thanks, Fiona. I'm in quite an echoey room in a strange place in the Royal College of Art in London, so I hope it won't detract too much from today's presentation. Fiona, I think, described well Design Hopes, so I don't really need to go into too much more detail about that, I don't think. It's a collaboration of 5 Scottish universities, but with other partners, most prominently the NHS Scotland. Across all, I think all of the NHS boards are represented. And we've based our work around 7 themes. And again, 5 of those themes that Fiona spoke about originated in the NHS Scotland sustainability strategy. We added a further 2 digital design and exploratory projects because we didn't think the challenge was big enough. That's a joke, by the way. This gives you a kind of indication as to the team, and it's just a snapshot of the team. There are many others. I think we're probably up towards 60 or 70 people, a really rich and diverse mix of people from universities, from NHS Scotland, health and social care partnerships, SMEs, third sector, covering a wide range of not only design disciplines, but health and well-being and care disciplines. And the project is funded rather kind of strangely. I mean, it's a kind of, it's funded through the Future Observatory, which is part of the Design Museum in London. And there are 4 green transition ecosystem hubs across the UK. Design Hopes is one, Future Island is one based in Ulster, and then there are 2 GTE hubs, one at Cambridge and one at the universities of Bath and Cardiff, both of them looking at kind of architectural stroke housing, stroke mapping and planning work. And really the aims of Future Observatory of the Green Transition Ecosystem Hub policy and programme is really to embed circularity and sustainability across designed things like products and services and strategies and policies. We want to increase design's gross value added in the nations and regions. And so it's nice that Scotland has one of the GT hubs itself. So that kind of economic drive, that economic impact is as important perhaps as environmental. We're looking to support green transition and net zero transition behaviour change. We're also looking to catalyse and foster opportunities. And also include and support a greater diversity of voices and perspectives, and hopefully, include those that have perhaps been underrepresented in past programmes like this. So very early on, we made the connection that many people had made. This was clear from the kind of literature that we looked at probably a couple of years ago now, where human health is inextricably linked to the health of our planet and its natural systems. And that the climate and ecological emergency is a health emergency, but good health and social care can be environmentally sustainable. So our vision in Design Hopes is to embed design-led research and making and acting to accelerate real-world benefits within the health ecosystem. And maybe at this point, I'll point out that we are probably about 19 months into a 24-month programme. We've just submitted an application for extension funding, which will give us another 2.5 years. So that will take us, we have funding up to the end of September this year. and the extension funding will take us from October through to March 2028. There has been a clear shift, however, in that funding, in that the funding programme, the UK government wishes to see a translation from research into realisable real-world impact. But I think that's a good thing for us. As a design-led project, that's the sort of thing that we want to see. We want to move through the peak processes and activities of exploring problems, perhaps reframing them, creating ideas, and then catalysing those ideas in real-world products, services, systems, environments. We've used the Design Council Systemic Design Framework as a loose framework, I guess, for a lot of our work. We've held 4 sprints thus far. We also have work in communities of practice, looking at green futures, storytelling, and also design policy, as well as some other activities in things like exhibitions. We had a work in progress exhibition at the V&A. We have one currently at the University of Strathclyde in the Technology and Innovation Centre. And we have another exhibition planned in September at both the V&A in Dundee and also the Design Museum in London. So we based the work on those 5 themes from the Scottish Government NHS Scotland Sustainability Strategy. I'll quickly go through these. Each of these themes are represented by a small team, so they're led by a theme lead. Here, theme 1 is led by predominantly architects based at Strathclyde. The interesting thing about this, it kind of connects to one of our other themes, theme 5. Theme 2 is about travel, which is a significant issue, reducing the environmental impact of NHS Scotland's use of things like vehicles and transportation is high, and obviously there's a lot of opportunities there through things like moving to different forms of transport, promoting vehicle recycling and promoting active travel, etc. Fraser's going to talk a little bit more about theme 3. I lead theme 4, which is largely, well, has largely been based around soft products, textile-based products, so moving from existing polyester, i.e. plastic, single-use, predominantly, products to more plant-based, reusable, longer living, 100% biodegradable, 100% sustainable, and those products having not just an environmental impact, but also a socio-economic impact. The Communities Project works closely with Theme 1, Buildings and Land. The interesting thing about NHS Scotland estates is it's, I think, one of the largest estates in terms of land mass across the whole of Europe. So there is perhaps significant opportunities there for designers and others to promote and utilise more of that estate in a productive and positive way. We have teams of researchers at Abertay and Dundee working on Flow, which is under the digital design theme, which is an interactive game looking to triage patients and others through the kind of care pathway programme at NHS Tayside. And one of the exploratory projects that has gained a lot of traction is Mediflax. So again, linking to 2 of the other themes, where there is a potential for growing our own textiles like we used to do once upon a time, which can be much more sustainable, can be regenerative in nature, and can lead to new jobs, new green jobs in the country. So really the impact that we're looking for is to design sustainable interventions to meet urgent net zero goals, but also to move beyond them. One of the things that's been very close to many of our hearts is we look to support early career design researchers with funding, and we've run a number of design challenges, and we'll shortly fund the next batch of Design Hopes challenges. And this gives young design graduates from across Scotland the opportunity to develop their ideas, working with mentors in Design Hopes and beyond, and design and develop new products, services and systems. And we have some good outputs from that. This was our exhibition that ran from December to February. We'll be shortly back in the V&A in September, and also at the Design Museum in London. Currently, the Design Hopes Work in Progress exhibition is on at the University of Strathclyde's Technology and Innovation Centre. It will be open till the 13th of June, which allows it to be open for the NHS Scotland event there on, I think, the 9th of June. And also our ECRs have organised a symposium recently, and again, looking to kind of encourage new voices through a range of different kind of outlets. So yeah, I lead just a little bit more about care. I lead the care theme. And what you see here is a photo shoot. We've developed these reusable theatre caps, which is a project that kind of predated Design Hopes and was instigated by the Golden Jubilee Hospital in Clydebank. And we're looking to move away from single-use disposable theatre caps. An average hospital will use somewhere in the region of 200,000 a year. And we've developed these plant-based alternatives and gained fairly significant traction across kind of the kind of UK media scene, both nationally in Scotland, but also wider afield. And currently we're in the process of doing a longer, much bigger user testing study with, I think, 253 theatre staff across Scotland. That involves 14 NHS Scotland health boards. And what we're doing is we'll produce 4 reusable plant-based theatre caps for each of those 235 people. The caps are digitally printed in Macclesfield. They're then manufactured in Cumbernauld, and then we will deliver them to those 235 people for wider user testing and feedback. We've also been doing a number of laundry tests and biodegradation tests, and you can see there that the cap has been washed on the left over 350 times. We've probably added another 100 washes to that. It's standing up incredibly well. So it looks like one reusable theatre cap will, substitute in excess of 450 single-use disposable ones. So there's obvious environmental and economic and perhaps socio-cultural impacts there. We've also developed that work now into theatre scrubs. So researchers in the theme held a pop-up display in the Golden Jubilee, and we got really good reaction and response to the scrubs. That pop-up really focused on a number of things that emanated from the comments that we got back on the kind of design probes that we used on the left, which were paper-based little paper scrubs. And those focused on things like the garment materials, the materiality, which are largely polyester or polyester mix, the fit, which is not great, and also the kind of structure and functionality. So we are now in the process of producing a range of prototype scrubs, I think 4 or 6 sets. We're working with fashion designers and textile designers from academia, but also from local SMEs. And we will present them and exhibit them probably both at the V&A Dundee and also at the Design Museum in London. So as you can see, the process for these caps is people can customise them themselves. They can choose their own patterns. They're 100% recyclable. They're 100% biodegradable, according to our initial tests. And you can get a sense there of the kind of plant-based nature, the regenerative nature of the theatre cap, where they come from sustainably managed forests. That wood pulp gets turned into fibre, which then gets turned into yarn and fabric, and then ultimately gets turned into these reusable theatre caps, but also the scrubs. Thank you. Please get in touch if you have any questions, and yeah, look forward to hearing more about your questions and opinions after Fraser. Thank you.
Thanks, Paul. over to Fraser, who's already got his slides up. Over to you now.
Okay, good afternoon, everyone. My name's Fraser Bruce, and I'm a design lecturer and researcher at the University of Dundee and a research lead on the Design Hopes project. So following on from Paul's presentation, I'd just like to present another project within the larger Design Hopes remit, the Green Ward Toolkit. And this is a project in collaboration with other colleagues from across the University of Dundee and NHS Tayside. So just a bit of kind of context and background. I think most people would acknowledge that the healthcare sector is, an unwitting contributor to the climate emergency. And just some kind of quick facts, for example, if healthcare was a country, it'd be the 5th largest carbon emitter. 4 to 5% of UK emission comes from healthcare. I think we might have mentioned 6% even today. Healthcare is the biggest public sector emitter. 4 to 5% of road traffic is related to NHS business. Loss of biodiversity is caused by things like mining, plantations for supply chains such as latex gloves and medical instruments, and the release of toxic chemicals into the environment, often through water pollution, can increase air and water pollution and unimaginable damage to the wider ecosystem. Within the NHS, carbon emissions arise from various sources, including kind of medicines and chemicals, kind of 20%, medical equipment 10%, and more significantly other supply chain activities, which account for around 24%. To ensure a livable future, in a sense, it's essential to reduce kind of greenhouse gas emissions by 45% across all sectors within the next 6 years. And this process is referred to as mitigation. However, even if with immediate substantial reductions in emissions, global temperatures will continue to rise for the foreseeable future. And we're already witnessing changes to our climate as we speak. So therefore, there is also a need to adapt. So while the primary aim of mitigation and adaptation is to reduce greenhouse gas emissions and respond effectively to our changing climate, these efforts may have kind of secondary implications for health. So these impacts may be detrimental, but they also present opportunities to enhance health and well-being and to address inequalities. So for example, we need to change how we travel to reduce transport associated with greenhouse gas emissions. To do this, we need to create, like Fiona said earlier, integrated and cost-effective kind of public transport systems, integrated with safe active travel networks. So not only will this lead to kind of reductions in emissions, but also improved kind of air quality. People will be more active. There is a potential to reduce inequalities related to access by making transport kind of more accessible and even more affordable. So some may question the impact that more sustainable healthcare can have on mitigating the climate crisis when globally healthcare only accounts for 5% of emissions. However, we should also remember that global healthcare is responsible for 12% of global domestic product, and healthcare intersects with at least 70% of global supply chains. So if we decarbonise our kind of health systems aggressively and quickly, we could tip that world's economy to a greener one. Within complex systems, Daniela Meadows, she identifies these sort of leverage points for intervention across a system, ranging from tangible elements and feedback loops to more kind of abstract elements such as kind of mindsets and paradigm shifts. And it's at these sort of kind of higher level points that more significant and impact changes are likely to happen, leading to this system-wide change. So the Design Hopes programme, like Paul's mentioned, has over 15, 17 plus projects across NHS Scotland, each operating at different levels within the system. And I think it's important to note that even a small intervention at all these different leverage points in the system has a real potential to lead to system-wide change. The Green Ward Toolkit that I'm about to speak about complements and kind of extends objectives outlined in the NHS Scotland's climate emergency and sustainability strategy by supporting priorities. Our Green War Toolkit project is ultimately about staff empowerment, shifts in mindset and behavioural change. So the Green War Toolkit, it aims to guide healthcare staff, providing them with the necessary knowledge, tools, resources to empower them in implementing new sustainable practices. The toolkit aims to inspire change by challenging norms, promoting circular economy principles that it's already been alluded to earlier by Fiona, and raising awareness about sustainable opportunities, specifically within a ward setting. And hopefully this will result in a capable and skilled workforce to provide a more greener healthcare system. Herbert Simon, so I just really want to talk a little bit about design. Herbert Simon was influential in the development of design thinking, receiving the Nobel Prize in Economics in 1978. And Simon said this about design: everyone designs who devises courses of action aimed at changing existing situations into preferred ones. So design thinking, it's creative, it's a human-centered approach to problem solving and innovation. So regardless of our backgrounds, design has a significant role to play in addressing both healthcare challenges and net zero goals. And so all of our projects are about driving change in healthcare systems or changing existing situations into preferred ones. The Green War Toolkit project, similar to the larger Design Hopes programme, is underpinned by the UK Design Council's Double Diamond process model to apply design thinking as a guide to design and develop the Green War Toolkit. Some people might be familiar with the process. You pretty much start in the middle. If your problem's well defined, it might just be kind of a straight line to actually come up with delivering a solution or creating a piece of innovation. But we would always, or I would certainly always argue that you need to jump back, kind of question the brief a little bit more, diverge out, using a variety of kind of research tools and design-led methods before you actually come back and define the actual brief, or you're actually working on the right problem in the first place. From that point on, it's about again diverging out, coming up with ideas, solutions, before you then actually move into this idea of actually finishing the product or service or experience or the solution, and then seeing how that actually delivers in the marketplace. So this is our kind of design thinking process that we use for the Green War Toolkit project. We discover what people need, we define those needs into a brief, we develop these sort of innovative solutions, and then focus down on the delivering. So you can see it's called the Double Diamond because it's pretty much, two divergent, convergent thought patterns and actions with these successive iterative stages of discover, define, develop, and deliver. And I like to think about it in the sense that the first diamond's about designing the right thing, and the second diamond's about designing the thing right. In the early stages of the Green War Toolkit project, we set up a pop-up installation at Ninewells Hospital to engage with healthcare professionals, raise awareness, gather new leads. This was a kind of physical space, allowed us to understand barriers and challenges related to net zero, as well as generate ideas and actions for the project. We used interactive features to facilitate conversations, capture valuable insights. For instance, we collected staff opinions on workplace sustainability through playful, engaging methods, including using counters made from waste plastic to gather responses. The following slide is just like a brief time-lapse video demonstrating that healthcare professionals across NHS Tayside showed genuine interest and willingness to engage and share their expertise. So data from the pop-up installation showed that, while staff understand the importance of sustainability and net zero, they have different levels of kind of knowledge and experience, and at times lack the clarity on how to apply it in workplace settings. So through the pop-up installation, we found challenges around pharmacy processes, medication management, staff behaviour, equipment reuse, but we also discovered numerous innovative ideas and initiatives across NHS Tayside, such as visualising waste management, addressing upskilling and training needs. We then employed an interactive research station outside the ward at Ninewells Hospital in Dundee to engage staff in sharing and prioritising sustainable kind of workplace activities. So exercises encouraged participation, and we gathered valuable feedback which directly contributed to the shaping, the development of the toolkit. So one of the exercises included the use of kind of prioritisation matrix to guide conversations, specifically around themes and actions. A total of close to 40 staff from the ward engaged with the research station. Initially, we identified 14 sustainability themes, with themes like waste and proactive care as top priorities. This engagement kind of offered valuable insight into how healthcare staff on this particular ward perceived and prioritised sustainability, thus helping us refine and consolidate the original themes into 8 overarching categories for the final toolkit. So, and they include waste, sustainable travel, proactive care, green team, water and pollution, medicines and prescribing, green space and energy. Over the course of the project, we've also been developing case studies from NHS sources as part of the toolkit, using the SBAR framework to kind of communicate the information in a clear and meaningful way. So this is an early example on ward pharmacy, outlining the situation, the background, the assessment and recommendations for pharmaceutical waste. So just really concluding, in the context of our project, we are currently developing 4 components of the Green Ward Toolkit, hence the reason we've kind of called it a toolkit. So the Green Ward Toolkit has been developed into a web-based platform to power NHS staff in implementing new sustainable practices. We are creating a speculative physical digital device. Is being curated and tested in wards to display real-time carbon emission data to support that behavioural change. So this idea of real-time instant feedback on things are actually changing when people are doing things within a ward setting. We've got case study frameworks have been developed to showcase kind of practical and achievable sustainable practices in secondary care. And finally, the creative methodology that you've seen a lot of the pop-ups, the interactive research stations. We've also got a patient pop-up that we're developing in order to pull together not just staff's opinions on sustainable and net zero, but also patients as well. And we're packaging up that creative methodology as a kind of standalone output to support the future integration of the toolkit. So in summary, like Paul and Fiona have mentioned earlier, the climate emergency is a health emergency. In collaboration with colleagues from across the University of Dundee, NHS Tayside, we have adopted a design-led approach in developing the Green Ward Toolkit, which aims to provide staff with the knowledge, tools and resources. And we're currently developing this probably over the next 2 to 3 months as a kind of final proof of concept. So that really concludes my presentation. So thanks for listening. And please stay in touch and find out more through the website, Instagram and X and Twitter. Thank you.
Thanks, Fraser. I think that now we still have a little bit of time, not very much time, for questions. Colleague Frances is probably hand over to her because she's been monitoring questions we've had, because there were a couple in the chat, I think.
Yep, I think there's one here for you, Paul. Just saying that the theatre camp example is really interesting, but assuming that you've also factored in the energy usage associated with washing at 60 degrees, and has that been part of your business case?
Yeah, well, that's current policy, and in the laundry testing, they're being washed at 60 degrees. However, I think there is, I think that could perhaps be challenged in future policy. Depends what you mean by factored in, because I think to kind of measure the carbon journey, if you like, of single use against reusable is incredibly complex. And I think we spoke a lot about environmental, and I spoke a lot also about socioeconomic impact, which I think we can get to with the reusable theatre caps. I think there's other factors involved, like ethical and moral dilemmas here. So we don't really know where these single-use disposable theatre caps are manufactured and the conditions attached to people that are manufacturing them. The other things are, these are plastic-based theatre caps that will microshed, and we don't really know the full consequences of what that does to the human skin. So if you're wearing scrubs and a theatre cap, the micro shedding of plastics, we don't know how that is absorbed into the skin, which is the biggest living organism that we have. So it's potentially quite risky. If you put them in landfill, then they will still be there after 200 years. The reusable theatre caps will biodegrade, we believe, in about 1 to 3 months. So I think when you talk about factors and trade-offs, it's quite a complex case to measure, because there's things like, that they're manufactured in another part of the world, they're then transported en masse, predominantly from China to the UK and then to Scotland. So there's quite a lot of factors involved. And again, ultimately someone will make that decision. We hope that, there will be a shift to reusable, that we can launder again, that we can manufacture in Scotland, and that we can attack and those targets, and we can achieve those targets, but there needs to be some willing attached.
Thank you. There's some other questions. Yeah, no, it's really interesting, all the different, from a transportation point of view to a procurement point of view, there's so many different factors to be kind of included. Other questions round about for both of you, round about the kind of barriers and obstacles that you've encountered during your projects. It's very vague, but if somebody wants to
I think,
answer that.
I'll jump in first and then maybe Fraser can answer. I think there's two main ones: procurement and infection control. But I do think
there.
I do think, look, I think the other thing to say is all of the people we're working with in NHS Scotland are amazing, really passionate, beautiful people. They're only trying to do the best for the people they care for. So, we're working closely and carefully with them. So we understand the challenges that they have in infection control and procurement. So we're hoping to kind of, to meet those challenges and address those challenges together. It's not that we are dictating what needs to happen. We're working very closely with these amazing people.
Yeah, and I'd probably just kind of link that sort of question directly to the Green War Toolkit project. And I think one of the kind of obstacles and challenges that we have on our project in a way is all hospitals are different. So if you look at Ninewells Hospital, for instance, trying to understand their carbon emissions, say in a ward setting, is it's localized, and it's really quite difficult to do that, because you've got to start to isolate things. And so like Paul said, if everybody's willing to support you, but there's real challenges around that. How do you get real-time real-time carbon emissions for, say, a single ward? Now, we visited, as part of our project, we visited Balfour Hospital up in Orkney, and everything's set up brilliantly there, how they can control energy in rooms and just monitor their carbon emissions. And that's a fantastic hospital, but not all the hospitals across Scotland are like that. Dundee's different to Glasgow City and Golden Jubilee and so on. So it's how do you kind of monitor that sort of carbon emissions, rather than just getting large sort of readings for energy and water, for instance, that are quite high level. So that's been a real sort of kind of obstacle and challenge for us, but you've just got to stay positive and just kind of keep on pushing through with the projects, knowing that change takes time, and we just hope that everything we do is just a sort of has a ripple effect that takes us to the next level.
Just one last little question that's came in there. So what are the anticipated short-term and long-term impacts resulting from both projects?
Really short term is in terms of the scrubs, we're going to manufacture, I think, somewhere between 4 and 6 new sets of scrubs. There's many things that could be improved upon in terms of the materials, in terms of the fit, in terms of personalisation. So learning some of the lessons that we've learned from reusable theatre caps. I think we're keen on doing something like a fashion show somewhere, sometime, to raise awareness. We've also got the 2 exhibitions coming up in Dundee and London, so that's kind of short term. I think longer term plans for the textile based work is we're looking to start a startup company. So whether that's a commercialization thing or it's a more kind of community interest type thing, we're not entirely sure. But we see clear, given the kind of marketplace, we think there are clear kind of opportunities there, certainly environmental, but also socio-economic, i.e. to make new green jobs in parts of Scotland that desperately need them.
Yeah, and I was just, I think I was just Paul's really answered that really well. And I think the only thing I would add to that in terms of the sort of shorter term sort of impact is it's, change. We've not got time. Fiona talked about how long time we do have to kind of address some of these urgent issues. But in that short term, it's also about kind of creating stories of change, and it's a term that we've been using when we've been kind of showcasing outputs and exhibiting our work. It's about those sort of stories that they create these sort of kind of mechanisms that allow us to kind of keep on collaborating with kind of colleagues across NHS Scotland, and and hopefully that change will then kind of promote more innovation, kind of lead to more jobs, and and address the challenge at hand, really. And the only other thing really for me in terms of the sort of longer term, and it's not just for the Green Board Toolkit project, it's probably across all projects, really. I think we're gathering really good evidence as well that we can then kind of use to kind of measure and make change happen, whether that perhaps not right now, but perhaps for kind of policy, government, further down the line as well.
Thanks for that. I think I'm conscious of time and we're kind of overrunning somewhat, and I should it's kind of maybe time to wrap up. So I really appreciate though, have both of your presentations kind of giving an overview of that. There's a lot of different avenues, and also there's a lot. It is, I like the idea of stories for change. It's actually giving people ways to actually see that it is relevant to them and how it's relevant. So that what appeals about the it's been done in lots of different areas, but it's really vital that people feel it is for them. And that's in the way that we would talk to people about saying it is very much about innovation is everybody's business. It is actually coming up with solutions and improving what they do, improving the environment, improving the products and how they do things. And so hopefully this is kind of inspired. Hopefully folk will get in touch with you to get more involved or see how that they might be able to apply some of these proof of concepts into their own boards or health boards and their teams as well. So I've got just a couple of things to finish off with to say. Our next webinar is going to be focusing on post-market surveillance in terms of medical device regulations with BSI and Elaine Gemmell, who's our head of regulatory affairs, and also we've had an ongoing theme of sustainability, call out for sustainability related ideas. It might only be an element of it. It might be, we need something new, but it needs to be made in a different way, or everything's single use. Why do we need to, are there not other ways we can do things differently, or thinking about how something's manufactured differently? So keen for you to get in touch with us to talk about those. And if your last kind of thing really is, if you're not signed up to our newsletter, please do. There's a QR code there to sign up, and I think there's a poly survey to asking for your feedback, so we'd really welcome that and any other ideas. But I think to finish us off, like to thank you both Paul and Fraser for your time today, and for the questions that came in as well, and for everybody who's been joined us today for your time, and look forward to hearing from you or seeing you again soon. Thank you.
Thank you.
Cheers.
Bye-bye.
Bye.